Hello everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, today I'm going to talk to you about a rather common problem that a lot of people don't know about, especially with their babies. That's constipation. You know, we think of a baby going poop all the time, and we hear the horror stories of goes everywhere. But oftentimes we'll see babies that have constipation. Oftentimes this is more due to formula than a lot of things because it's hard to digest. And it's just their body's not equipped to take some of that formula in. Now, breastfeeding babies, they won't go to the bathroom as much. They won't soil their diaper nearly as much. They can go for maybe 2, 3, 4 days. They might not even soil their diaper that long because it's pure food, meaning they're taking it in and everything they're taking in is getting used up. But still, you want to see them poop. And you know, moms, they generally know. They know the cycle of their baby. They know what their baby should be doing. So if they have every apprehension, this is some things to consider. Now, signs that your baby might be constipated. Obviously, if there's force or strain with this, or if the stool's really hard, it's actually coming out in pebbles. And then and sometimes it might even be a little blood in the stool. And it'll show up as a red, bright red, because it's towards the end when they're trying to go poo. So, what are some things that you can do to help your child get over the constipation on your own? So, first of all, I'm going to say if you can breastfeed, and if you haven't done that, definitely breastfeed. There's many advantages besides being able to allow your baby to go to the bathroom a lot better. You might even, if you do formula feed, I understand that breastfeeding might not be an option for you, and I don't want to discredit any women who don't breastfeed. By all means, there's certain circumstances you can't do it. So goat's milk is another substitute, which I tell a lot of women that would definitely help. It's more digestible, a lot more digestible than formula too. But formula, if you're going to go with formula, you can use that. Formula will cause a little bit more constipation than usual, but you might also want to feed your baby a little bit more water too. It makes the stool softer, and you can do that. Also, exercising your baby. So if if it was an adult, I tell them to get out and walk because that's going to improve the digestion. But also, we'll say like this, where the baby can exercise and they're laying on their back. This is my dial I show people on. But you take their legs and you just do a bicycle motion. And you do that, a minute or so, 2 minutes, and the babies might even enjoy this too. But it's going to get the circulation moving. It's going to get bowels moving a little bit better, and take care of that. But if you do have any questions, let me know. Be happy to help in any way possible. Because I do see kids in here that, as a last resort, parents will bring them in and say, my baby's having a hard time going poop. Can you please help them? Hey, if these don't work, might be a possibility. I know suppositories, they all sometimes use them as well, and as a last resort in enemas, but that's very hard to do on a baby. And there's other ways to get around to that. Hey, if you do have any questions, please let me know. Give us a call. If you think this is useful, pass it on to somebody else. Make sure you share. They can thank you for it later. Have a wonderful day.